This morning, the debate over bail reform. While looking after the civil rights of defendants, are we making our citizens less safe by releasing the accused without bail? Plus, the coronavirus. What is it? What are the symptoms? Is it coming here? And how do we best protect ourselves? We'll hear from a public health specialist.
Now from 42nd and 2nd, this is New York's very own Pix 11 News Closeup with Marvin Scott.
Good morning. It was exactly 1 month ago that New York State enacted a law that eliminated the need for suspected criminals to post cash bail. Democratic members of the legislature viewed the old system as discriminatory. While well-heeled suspects could post bail and await their day in court in freedom, poor suspects, still presumed innocent until their day in court, could not come up with the cash and had to remain in jail. Just days after the law took effect, there was backlash and incidents that convinced many in law enforcement and the governor as well, who approved it, that the law was too broad and had to be modified. That debate continues in Albany. Joining me now in discussion is Assemblywoman Nicole Malliotakis, who feels the law is too broad and she is leading a Republican charge to repeal it. Nicole Triplett is Policy Counsel for the New York Civil Liberties Union. Thanks so much for coming in. Nicole Triplett, let me ask you this. It's been in effect 1 month now. Do you consider this reform a success, or in view of the incidents that have been reported, does it have to be modified?
Certainly a success, Marvin. I think what many need to realize that for decades and generations, we have had a system that overwhelmingly benefited the wealthy and impeded most New Yorkers' access to meaningful justice. And so what this new law does is make strides to attempt to right those wrongs by doing three things. One, by shoring up due process. We needed to achieve and fulfill the principle that our system was baked on, premised on, which is the presumption of innocence. Two, it reduces the reliance on money as a determinant for liberty, which again feeds into the deep inequities that we saw in the system. And three, it addresses some of the racial biases that we knew allowed a two-tiered system that treated people marginally and differently.
Now, it was intended to bring about fairness, but is this fair to the public safety?
Well, look, I think it's jeopardizing public safety, and the issue here is that we could have achieved some of what she's talking about if we just ensured that everyone received their constitutionally protected right to a speedy trial, investing in our court system, adding clerks and officers as well as judges, and making sure these cases are heard. The problem with the argument is that we're not dealing with just low-level offenders or first-time offenders. We're dealing with individuals in some cases that have multiple felony convictions. They have a history, lengthy rap sheets. You had someone, 24 prior arrests, who punched a police officer and returned right back onto the street. You had somebody who also admitted to crimes that are being released, such as an individual in upstate New York who slit his girlfriend's throat, charged with manslaughter, and he was released on January 1st because he could no longer be held, even though he had confessed to the crime. So there needs to be some type of judicial discretion to consider someone's dangerousness to society. And currently, New York State, under this law, is the only state in the union that doesn't consider dangerousness.
Now, shouldn't judges be given the discretion, given the circumstances? I know we have 400 offenses here that are considered misdemeanors or low-level crimes that would enable suspects to be released without posting bail.
Yes, I want to clarify two things, and I think there's been a chronic misunderstanding of what the new law did, but also of what the old system allowed. Under the old system, people were being released on the same charges that people are being released on today. It was just if you could afford bail. Bail,
but you had
as a
judicial
concept,
discretion, though.
Judges still, and I think that's the second thing that I want to clarify, Assemblywoman, that judges maintain discretion in every case.
No, they don't.
This is not a law that stripped away judicial discretion. What I think Assemblywoman is referring to is that in New York, yes, we have said that bail is intended to ensure people back to court. And what this new law does, which is what we needed, is to allow judges to have better ways to ensure what will actually ensure the person back to court in each individual case, without referring to what's in someone's bank account or what is in someone's wallet.
Judicial discretion has been stripped, and everyone acknowledges that. In fact, we are the only state in the nation that does not consider dangerousness. And a matter of fact, someone who had 12 convictions, 6 of them were felonies, had not come to court previously for 5 other cases, was just released without the bail. The judge claims it was this law. So either there's a misunderstanding by the judges, which I don't see that being the case, and it's clear that we are not being as restrictive as we should be. And by the way, when you say low-level offenses, we're talking about some violent crimes here: strangulation, assault, criminally vehicular homicide.
As recent as today's paper, the headline here is someone of the DWI that resulted in a fatality.
That's actually the one I was talking about. Right. That's the case I was talking about.
Was released, and he was braggadocious that I'll be out of here tomorrow.
He didn't even show up for court, and they had to put a warrant out for him. Now you're putting more, pressure on the police that have to go out and find these individuals who are not returning for court. So there's a balance here. If we were to use low-level offenses, first-time offenders, they can be part of this program to be released without bail. If you have a criminal history extensive, you have multiple convictions, you show that you don't return to court, you pose a public safety threat, we're seeing these individuals released and they're committing the same crime, released again, like the bank robber who committed 6 robberies and he keeps getting released.
To clarify, the new law, and respectfully, I've read the new law. The new law allows the judges to maintain discretion to be able to set and impose certain restrictions on release, and then when they don't show up to court repeatedly, they are allowed to detain the person. So I think it's a mischaracterization
they have to commit multiple crimes before they actually detain
that's not the case. That's not the case. It's a mischaracterization of the law to suggest that judges have no discretion, because at every point judges do maintain discretion, and I think by repeating out or at least listing out the charges, it's misleading to people because it suggests that poor New Yorkers are inherently more dangerous than more wealthy.
Not
because
at all.
Under the old system, these charges were eligible for release. Like, people charged with these crimes were eligible for release, and this has always been the case. What is a bit disappointing and a bit off-putting is see the outrage and the backlash when now we're trying to make the playing field more even.
The judges themselves in these articles are saying that they had to be released under this law. The judges themselves are saying it.
It needs perhaps some clarification in the law to give judges that discretionary power that they have to use their judgment whether or not to release someone in a particular crime, such as the DWI. He was released and he was bragging about the fact, hey, I'm going to be out here tomorrow. And what about the other one who had 4 bank robberies? They let him out and he committed 2 more. There's another. There was one incident after another.
The law allows, if you're out on a felony and you end up being rearrested on another felony, the judge does have discretion. And I don't want to get too much in the weeds, but that is just those are the facts of the law.
They don't know about it.
But I will say that a lot of the things that we're seeing were never intended to be resolved by bail. I think what we're seeing is not so much of the shortcomings of the new law, but the failures of these carceral interventions that have constantly and repeatedly served as placeholders for other issues. Failures like for us to be able to address mental health services and supportive housing and other social services.
Quickly,
if I could just say, you know what, this was done in the middle of the night. There were no public hearings. Afterwards, law enforcement, the DA's association, they came out against it. Multiple elected officials. Now you're seeing Democrats as well joining us and saying that it needs to be changes, even those who voted for it, some of them. The thing is, we did this in the middle of the night. The governor shoved this down our throats. He didn't allow public airing of this policy and take into everyone's opinions into account. So it was done hastily. We need to revisit it. We can achieve something here that ensures that everyone gets their constitutionally protected right to a speedy trial. We can consider when it's low-level offenses or first-time offenders, but we have to consider dangerousness.
Got to take a break. We'll pick up on that.
Okay.
Stay with us as Pix 11 News Close-Up continues.
You're watching New York's very own Pix 11 News Close-Up with Marvin Scott.
Back now with Nicole Triplett of the New York Civil Liberties Union and Assemblywoman Nicole Malliotakis. And when we left
Yes,
you said you wanted to make a point.
I just wanted to respond to what Assemblywoman just said about the lack of input. I think it does a disservice to the public to suggest that this law was not widely debated, that it did not have the input of communities, a wide array of communities across the state. There's public testimony given by members of the law enforcement and DA offices that's on public record, and I think this is a complicated issue. And I just want to go refer back to something that we've discovered in our research. Going back to the deep inequities that were baked into the old system, we realized that the majority of people in jail were in jail pretrial detention for low-level offenses. Bail amounts $2,500 and below, which strongly suggested that we weren't talking about safety, but we were talking about criminalizing poverty. People who would be released but for not having money to a couple of $1,000s to post for bail is highly problematic.
Marvin, look, there needs to be more public criticism and debate about this. This bill was brought to us at 11 p.m. at night on the last day that the budget was due. It was snuck in the budget. It wasn't even a standalone bill that was debated on its own merits. We voted on it a couple hours later by message of necessity from the governor. He didn't even give it the 3-day rule to review it and have the public input of the actual language we were voting on. I can guarantee that not one legislator who voted for this bill actually read it. It's impossible to read that many pages in the few hours that they gave us to review this bill.
Now, you have to admit that all across the state, law enforcement agencies all across the state are reporting a spike in crime ever since this law took effect. Doesn't that send a message out there that there has to be some modification of this law?
It doesn't. We've seen a law that has only been in effect for less than a month. To be able to take crime as serious as we should be able to see this law through for more months to figure out what are the root causes. And if we were really serious about root causes of crime, we would look at the issues that I mentioned before, which is the lack of access to mental health services and supportive housing and to drug treatment. But this law will allow more pathways forward to allow judges to be able to grant defendants access to those services.
She's right. It's only been in effect for a month, but yet in that month we've seen robberies increase, burglaries increase, shootings have increased. So these are major concerns. Transit crimes have increased. These are issues, and when you see the same person being arrested and released in the course of a week, that's a red flag that we need to address as a state and as a community. I
mean, case in point, this Tiffany Harris in December allegedly attacked an Orthodox Jewish woman in Brooklyn. She went in, she was out, allegedly committed another crime, and then back in again, and then there was a third instance where she was brought in, but now she can post bail because she's under federal arrest for hate crime.
I'm glad you mentioned that case. That case does not reveal shortcomings of the new bail law as much as it reveals the shortcomings of these carceral interventions. What we saw in the Tiffany Harris case is that she needed mental health services, which she received. When the federal government pressed charges, they ended up uprooting her from the services that she was actually getting, which was the root cause of that crime, and now she's back in jail, which is only going to exacerbate the problem. And I do want to respond to some of these proposals to suggest that the new bail law is the reason for some of these spikes in anti-Semitic attacks, which is just false.
Well, I didn't say that. I said it was the rise of robberies and crime. However,
right.
Anti-Semitism is a different issue altogether.
It's a different issue altogether.
The hate crimes are being released with no bail under this law, and that is also something that has created a lot of outrage.
Which was happening under the old law, again, for those who could afford bail. But if we want to take, and I agree, we need to take anti-Semitism seriously, which is a problem that pre-existed the bail law, and we shouldn't use the new bail law to serve as a scapegoat for addressing the underlying reasons that we're seeing these spikes.
I understand where you're coming from, and there are a lot of people who agree with you. But would you say now, after this being in effect for a month, that we should at least take another look at it and give more power to the judgment of the judges? I mean, even the Governor Cuomo, who fought to have this law enacted, he is even saying now that we should take another look at it.
I think we need more time to see the new law. To be frank, what we've been seeing is a lot of misinformation on the new law and a degree of misunderstanding of what actually was changed. Bail was just one piece of it, and as a concept, as a theory, bail was never intended to be able to prevent crime. Bail was intended to be able to ensure people back to court. And if we want to talk about crime, I think we need to start a separate conversation to address those underlying causes.
The paper that you have there, that case, This guy did not show up to court 5 previous times. He violated a court order for an interlock device because he was a chronic drunk driver. He was released with no bail on that charge because he violated that rule. He actually went out and drank again and killed someone. So how many more lives we have to lose before we're going to get serious about public protection? There's a balance here that I keep advocating for. We can ensure, we can have an overhaul of the cash bail system, but it's got to be reasonable. We should be looking at other states that have done this without jeopardizing public safety.
Nicole, he shouted expletives at police who were trying to administer aid to the victim of this DWI, and he said, "This is only a DWI. I'll be out of here tomorrow." That's flaunting the law, isn't it?
I will say that
It's horrible.
That one, this was happening under the old system, and what we really do need to do is make sure that we're reading this law in conjunction with other parts of the law. We have other laws to be able to address these issues, and then we have areas of judicial discretion to be able to address this. But what I will say is, I don't understand a proposal to roll back the law as solving that issue.
Not rolling back, but modifying it.
Modifying it, but we have not seen the fruit of this law yet. What we're seeing right now are other problems that we need to address that have nothing to do with the new bail law.
Okay, now you have legislation. Assemblyman Brian Barnswell has introduced something in Albany to rectify this.
Yeah, look, Brian Barnwell and I'm co-sponsoring legislation with him that would restore judicial discretion, consider dangerousness, which is one major component of this. There are other pieces of legislation that the Republican Assembly Conference has introduced, and we're going to keep pushing. And I have a petition, over 17,000 New Yorkers, NicoleForNY.com/bail. 17,000 New Yorkers have voiced their opinion. They should call the governor and their state legislator, too.
As we said at the outset, this is a very complicated issue, and it's got the passion of so many people on both sides. It's a discussion that's going to continue. We'll have you back on this program another time. Thank you so much for joining me today. Nicole Triplett, New York Civil Liberties Union, and Assemblywoman Nicole Malliotakis. Thank you. And then when we come back, we'll hear from a public health specialist who focuses on infectious diseases. He'll shed some light on the spreading coronavirus. Stay with us.
You're watching New York's very own Pix 11 News Closeup with Marvin Scott.
As of the taping of this broadcast on Friday, more than 10,000 cases of the coronavirus have been confirmed, and in excess of 200 people have died. The World Health Organization has declared the outbreak a global health emergency. The United States has set its advisory at level 4, and that represents the highest safety risk. A number of cases have now been reported in this country. Just what is this virus, and how can we protect ourselves against it? To help us with that, I'm pleased to introduce Dr. Anthony Santella. He's an associate professor of public health at Hofstra University. He's a public health scientist and researcher who specializes in infectious disease prevention and control. Thanks so much for coming in. Now, this was first discovered in China, has now spread to countries all around the world. Just what is the coronavirus?
So the coronavirus is a new virus, part of the coronavirus family. And that family of viruses have been around since the mid-1960s. And they largely have begun with animals, livestock and other animals, and now have turned to humans. And now we're seeing the first cases of person-to-person transmission.
Now, that's wild animals which are used for food in China, in Wuhan, where it first originated.
Yeah, so with the 2019 coronavirus, we now know that the initial people who were infected in Wuhan had exposure and linkages to seafood and wild animal markets.
Now, the question is, it is spreading to countries around the world. We've had a handful of cases in the United States. How concerned should we be here? We've reached this risk level of 4.
So, we have 6 confirmed cases in the U.S. That number will probably increase. But, as you mentioned earlier, there are over 10,000 cases. There have been 213 deaths. 90% of the cases have been in China. 100% of the deaths have been in China. So we have very little to worry about right here. People should be much more concerned about the flu virus.
Explain that.
Well, we're in flu season. We have mediocre rates of flu vaccine uptake in the U.S. And the CDC anticipates that between 8,000 and 12,000 Americans will die this year from the flu virus.
From flu, not from the coronavirus. So you're saying that we really should be more concerned about flu and the coronavirus you don't see as being a real risk here?
Well, we still don't know. Right now, the 213 deaths represent about a 2% fatality rate for the coronavirus. Overall, flu has 0.1% death rate. Now, what makes coronavirus different right now is that a lot of sick people are presenting themselves. So we're going to see an increase in confirmed cases, confirmed deaths, because people are worried, they're getting tested, and they're getting sick. And if they die, we anticipate the deaths to be much higher now in the beginning, as opposed to when this whole thing kind of ends.
How contagious is it?
Well, we're seeing cases of person-to-person transmission, and what makes it a little scary or nervous is that we're seeing people who are asymptomatic without symptoms transmitting the virus. And that's what happened in Germany. A Chinese businesswoman went to Germany, she had some business meetings. A week later, the 4 businessmen in Germany were diagnosed with coronavirus, and she felt fine. That's why the general standard precaution right now is people traveling back from China should be in self-quarantine for about 2 weeks so that we can really tell whether they have symptoms or not.
So this is an airborne virus. This is caused someone sneezes or coughs?
So it is largely airborne, and it's predominantly affects the upper respiratory tract. And so when people cough and sneeze and don't cover their mouth, when the people don't wash their hands, when people don't go see a provider when they're not feeling well, or when they're going to school and work even though they're sick, that's how these diseases spread.
Now, how should people protect themselves? We see people wearing these masks. Are they effective?
So the best things you can do are the same flu preparation tasks, which include covering your mouth when you cough and sneeze. It includes getting your flu vaccine. It's still not too late. It includes going to see a provider when you're not feeling well, staying home from school and work when you're ill. It also means that things like the mask really aren't going to protect oneself. And that's why the CDC does not recommend those surgical masks that you see people walking around with, because something that's airborne can still you can still get exposure to it even though you're wearing the mask. And so the CDC does not recommend surgical masks as a form of protection unless you have symptoms, and maybe it's temporary till you go see a provider.
Again, specifically, what are those symptoms? People get paranoid. What are the symptoms?
Yeah. So it's basically the same symptoms of a flu.
But how do you distinguish between flu and this?
Right now we can't, and only the CDC can do the actual coronavirus testing. In the next week or so, they'll be releasing those tests and protocols to local international partners. But when in doubt, go see a provider. Make sure it's just not the flu. So things like having a cough, having fever, having pneumonia-like symptoms. High fever, pneumonia-like symptoms. Those are the things that you generally would see also with the flu. So when in doubt, don't take the risk, especially if you are around people who may have been traveling to or from China.
Now, would older people be more vulnerable to this? People already with health issues?
So people with underlying health issues, the elderly and young children, already have developing or compromised immune systems. And that's what happened in the most recent case here in Chicago. The woman had been in Wuhan recently, had come home without symptoms. Her husband had underlying medical conditions, and she transmitted it to him.
How does this compare to other viruses? We had a big scare from the SARS virus just a few years ago. How does this compare to SARS?
So, the World Health Organization declared this a global health emergency. This is only the 6th time they've done that. The previous 5 times had been for H1N1, Ebola. Twice they had done that with Ebola, polio, and Zika. And so things like Ebola, like the Ebola outbreak, had a 70% mortality rate. SARS had about 11% mortality rate. But those outbreaks have come and gone. Like I said, right now the death rate for coronavirus is about 2%. But who knows? At the end of the day, it could be as high as 10%. It could drop to as low as 1%, 0.1%. We don't know.
I have to ask you this, because a lot of people have been questioning, where does the word coronavirus come from?
So not to be confused with the beer, the coronavirus has a crown-like shape, the virus. And so corona, crown, and that's how the name comes.
Your final word? You say we should not be feared, just be cautious.
This should be about science and fact, not fear and rumors.
Professor Anthony Santella, Hofstra University, thank you so much for your insight.
Thank you.
And that'll do it for our broadcast for this week. If you have any comments or wish to see this broadcast again, log on to our website at pix11.com/newscloseup. I'm Marvin Scott. Greta Van Susteren and Full Court Press up next. Enjoy the rest of your Sunday, everyone.